All right, good morning, everybody. I am Jessie Whittish with Kentucky Youth Advocates. It is so good to see all of you today for a conversation around substance use amidst COVID-19. And just a reminder that we are recording today's forum to share as both a video and as a podcast. And because of that, we ask that you stay muted, but you are welcome to put your questions and comments in the chat if you like. And panelists, if you want to address those, you can. Or if we don't have an answer during the forum, we can follow up with you with answers for that. So with that, I am going to turn it over to Terry Brooks to get us started.
Good morning on our 31st Wednesday virtual forum. So thank all of you who are very regular, and we especially are excited to see some folks where this is their initial cruise with us. I would say that I want to kind of move the discussion along. So just understand if it's not chocolate, it's not candy. So really the whole prior discussion was kind of hard for me to understand. So a couple things before we start. You will not be surprised if you have been on this call before for me to offer a little unconventional request. I don't know if you noticed, but the Supreme Court issue was resolved yesterday, and next Tuesday, I think there's an election. That gives a window of 3 or 4 days, which I think could be really critical on COVID response. We have talked about this more than once, including conversations with Leader McConnell's staff, Congressman Yarmuth, and other players. If you're on this call because you have a special interest in opioids in the pandemic, I bet you that our friends at VOA would tell you there's a lot of federal dollars available if this gets done right now. If you're on this call and your beat is early childhood or child welfare, or do you want me to go on? There are billions at play. I have a feeling that magically links or what you're supposed to do or numbers might appear in the chat as we're talking. But I want you to understand that the summative action on Judge Barrett and the election really opened, in my opinion, a narrow window. Your congressman and both of your senators, especially Leader McConnell, need to hear from you now. If you're in the 3rd Congressional District, John Yarmuth would be playing a key role. So don't take a pass. This is a time to act and see if we can pull this one out of the fire. So I will now move on to the topic at hand. As you know, for 31 weeks, we have been trying to raise the issues of kids, families, and the pandemic. The pandemic related to COVID began last February. All of you on this call know that the pandemic related to opioids began far before that. Finally, I think we as a state realize that addiction is neither a moral issue or a justice issue. It's a public health issue. And we know there are so many leaders in Kentucky who have been saying that and acting on that for so long. So we wanted to kind of hit the pause button. I don't know if you're like me, but there's so much conversation about addiction in general. We wanted to hit that pause button and really think about the impact and implications of the pandemic and addiction and kids and families and the broader community. We have some just wonderfully wise and experienced folks to lead us in that conversation today. We appreciate them being here. We appreciate all of y'all being here. And I'm now going to kick this to Shannon Moody to facilitate the rest of the conversation. Again, just remember, if it's not chocolate, it's not candy.
Thank you, Terry. I respectfully disagree. So I appreciate that we've got three panelists ready for this conversation who are going to be talking about the different ways in which they work with folks who've been impacted by addiction issues. And just to make sure that we're all on the same page and kind of, you know, having kind of the same frame in mind, we need to make sure that we're treating and identifying substance abuse for what it is. It's a public health issue, not a criminal justice issue, even though there are intersections with those different systems. And also October is Substance Abuse Awareness Month and Parental Incarceration Month. So it seemed like a really appropriate and good time to be talking about addiction and substance abuse in the state of Kentucky. So I'm going to identify our three panelists, and then what we're going to do is just have them give a little bit of background and introduce themselves. Today on the call, we've got Toya Gatewood. She's the clinical manager at the Morton Center. Carolina Glover, who is a case manager for the Daviess County Circuit Court in the Family Division. And then Tiffany Hall, who is the Chief Operating Officer at Volunteers of America Mid-States. And Toya, if you'd like to start, just give a little background on what you do.
Hello, everyone. My name is Toya Gatewood, and I am the clinical manager for the Morton Center. I currently oversee all of the clinical programming for the Morton Center, and I also see clients individually and in group. So that's all.
Awesome. Thank you for being here.
Thank you.
Carolina.
Can you hear me?
Got it. Yep.
All right.
Yes.
So my name is Carolina, and I work with Daviess County Family Court, and I am the case manager for Judge Gordon. So and I specifically deal with JDNA, which is juvenile dependency, abuse and neglect dockets, and also with domestic violence. And yes, I have one in here trying to be cool. And so we have been pretty busy. And so I don't know what else you want to know.
I think that's a great start. And your little NTIer is totally fine, and we're not worried about any background noise, so don't worry about it. Tiffany.
Hey guys, my name is Tiffany Hall, and I am, like Shannon said, I'm the COO at VOA, a lot of letters there. And I have been with VOA for 18 years. And we do a lot of different things, but as it relates to today, the conversation today, we do really a lot of work in the substance use disorder space, specifically in family-focused recovery and family-focused treatment for moms and kiddos, and treating the whole family system. So excited to be a part of the conversation. Thanks.
Thank you all for being here again. So obviously substance use and addiction is not a new issue. I think most people know at least somebody who has been impacted by it, especially in Kentucky. So with that being said, and we know it's not a new issue, you know, what are we seeing in terms of the effects that COVID-19 is having on substance use or abuse, particularly among young people or among their parents? What are we seeing? And this is for anyone.
Well, I'll go. Since the pandemic, we went into our telehealth services began right at March the 18th. And so we've seen our numbers go up dramatically with parents who are suffering from alcoholism or drug addiction, and the increase in services needed to provide to the community recently. And so we've had to come up with a way to provide services via telehealth because we can't see people safely in the office, and that has been dramatic. Also, with kids being out of school, we haven't got a lot of referrals from the school system, which is where we usually would get those referrals. And so I'm thinking that once school goes back in person, we'll see an increased number of children who are also using as a result of the pandemic.
Yeah, likewise, to piggyback off what Toya said, we are seeing, alcoholism for sure, there's a huge increase of people reporting alcohol as their drug of use, which I haven't seen the latest number on our referrals, but it's a huge increase. Also, a lot more comorbidity issues, a lot more anxiety, and like Toya said, not only the school for sure, but just people are dealing with the systems that bring people into care a lot less, right? So when you don't go into a doctor's office maybe, and kids aren't going to school, and you're not maybe having to report as much to your parole officer. Just all those systems that kind of tend to be our referrals and be kind of the safety net, hopefully in some cases for families when they say like something's off. We're not getting as many referrals from those systems because those systems aren't having as much interaction with people. On the other hand, we're getting a lot more self-referrals and family referrals.
I would like to, from our point, courts, so regarding school, we have a whole day designated for school petitions. So once this March hit, we obviously, I think we just actually did it maybe a couple months ago, where we had to pretty much dismiss every school case, because obviously, the dynamic changed. So we got pretty much dismissed all the school cases and started from zero. And now we are starting to see now the small wave of petitions coming back, obviously with a different, requirements. So what they're doing is they're basing it on engagement, how often they stay logged on, all homework. And I can't remember the other aspects that they are taking in consideration when they're going to file. But I'm starting to see in the numbers of school petitions go up. Alcohol, that is also something that we're starting to see, which for us as a court is really hard to, address, because one, alcohol is legal. So it's not like we can just do a drug test and say, okay, this is, we have to send it to a lab. And it's just much harder to control and to be able to address when it comes to alcohol.
Yeah, so it sounds like services have changed, whether it's, being provided via telehealth or screens, or referral services or referral resources have changed as well. And it sounds like things are being modified on your all's end. What do we think is it, Tiffany, you talked about that comorbidity. Is it the stress? Is it what do you think is driving folks to be in these positions where they're self-referring?
I think anybody that, whatever issues existed prior, whatever propensities people had to whatever behavior, is going to be magnified during this time. Like maybe if you had a propensity, maybe eat candy corn and peanuts for breakfast. I'm not talking for myself, of course. Then you might do that more often during this time. But I think any amount of, any issue that existed, and these are obviously individual or kind of system issues, right, are going to be magnified. And so I think that, one thing that we've really pivoted and become really intentional about is an increase in our aftercare reach and our graduate outreach, because we just became very aware that people who had pretty significant amount of time sober and felt pretty good about their recovery. And in these circumstances, all of a sudden isolated, not able to go to a meeting, having their children under their feet, becoming a teacher, having to work, all the things, suddenly were struggling. So we've developed some kind of peer programs that are helping do some outreach, but I really believe that it just was kind of the straw that broke the camel's back.
Yeah.
In many cases.
So we're seeing a clear connection or an emphasis around that isolation and how it's impacting families pretty heavily. Is that the case for Toya and Carolina? Do you think that the isolation is driving folks into your systems as well?
For sure, yes.
I think, especially because if you it's driven me crazy. And I'm not saying I'm the perfect or healthy person, but I mean, I've had to. Judge will be like, you need to stay home. I'm like, no, I can go to work today. I'll be work. I'm not a stay-home mom. I have to make sure get out. So. And I have the opportunity, so I'm very grateful, but other folks don't. And a lot of them, I have 2 kids, but some of them might have 4 or 5 kids and they don't have support. I'm thankful that I do have, but some of them, they don't. So they are with the kids 24/7. And I'm pretty sure they love their kids, but it gets to the point that you need some sort of relief. If you don't have that, it definitely gets to you. So yes, I do. And a lot of times too, and even if they could have the opportunity to take the kids somewhere else, right now with COVID, sometimes they're not allowed to because the restrictions that we have in place. So it's just kind of like you're just stuck.
So obviously things are being exacerbated. Parents especially are being impacted by the stress, isolation, potential job loss, financial insecurity, and things of the sort. So how do we see that impacting other systems? Carolina, you kind of touched on that, how parents are coming into courts because of alcohol issues. But what other systems are we seeing folks who are struggling with addiction connecting with or intersecting with?
So obviously mental health and they're not able to, even though sometimes the telehealth is there, telehealth is not for everyone. So that's one issue. There's some people that they just need that face-to-face. We are thankful that some providers here in Owensboro are willing to do the face-to-face if if that's something that a client just requests. But that's one thing. And then I do think that the more time people spends at home, or that the stress level goes up, more time for them to get in trouble. So criminal, might be violating, their parole or whatever. So it's kind of like that ending cycle. Endless.
Toya, I noticed you shaking your head when Carolina had mentioned the telehealth. Do you have any thoughts or reflections on any of that?
Yeah, we've had a very huge increase of elderly people coming into services as well, which is different demographic than we're used to. So the geriatric population is struggling with alcoholism and also being able to use technology. And so, they are from old school and they do not want to get on a virtual, session with a therapist, even if it's going to be helpful, because they can't use technology. So we have had to have struggles with being able to provide services with the geriatric. They can't see, they can't hear really well. And so those are things that we've had to modify to provide services to that population, but also looking at what is the long-term effects of the alcoholism on that population and their morbidity of having secondary issues with health we can't bring them into the office safely because of their other underlying issues. So it's just an ongoing process. You know, we've had a huge increase in our family services, which are parents or friends or family members who have someone in their life who have substance use issues. And so they have increased in coming, and that's a free service that we provide to anyone in the community. So that has increased as well. And, you know, it's just ongoing. You know, parents are having 2 and 3 kids who have substance use issues and not just one. And, you know, the increase of that, and they're dropping out of colleges, and, you know, how is this being affected in the family system? So we've seen a lot of those increases in the last few months as well.
Yeah. And Toya, with Kentucky having one of the highest rates of kids being raised by relatives and a majority of them being grandparents, are you seeing any of those older folks coming in who are raising kids, raising grandchildren?
Yes.
Yeah.
And they don't have any resources. They can't teach their these grandkids NTI, you know, because it's before their time. And so all of that systematic impact of individuals not being able to navigate these systems that we now have in place.
Yeah, there's a lot compounding.
We have also a family emergency shelter at Volunteers of America that helps to again kind of be a safety net for families who have found themselves homeless and try to get them stabilized and back into housing. And there's this whole other layer of complication when you think about evictions not happening, and you know it has and then people falling so behind. I mean, I'm terrified to think about how you know, how behind folks have gotten and what kind of situation they're in or going to be in. But we have 3 family systems today at the shelter who all are, they're 2 generations. So we have grandparent and parent and grandchild all in the same, all staying with us. And so in so many cases, you know, obviously we have several generations living under one roof, and then when they find themselves homeless, and then there is, in one of those cases, also intersection with substance use disorder. So we're able to help give them IOP service, intensive outpatient service, while living there. But just the layers of complication that happen when you're thinking about serving all of that, those members, making sure the kids are safe.
And it sounds like it's a complex issue, right? And addiction doesn't happen just to the person who is having an addiction. It happens to the entire family unit and everyone surrounding, right? So that's what I'm hearing, and that's what I'm hearing we're talking about, is it's not just an isolated issue where one person is dealing with it. It's the whole family that then is impacted. And we know that you know, addressing addiction can help families stay together safely. There are models for that too in the state, right? I know that Freedom House is one of those at Volunteers of America. We also have the START program, which is showing really great efficacy. The K-STEP program, and I think we've got some START folks on the call. How does Volunteers of America specifically, how do you partner with START or those other programs? And then also within Toya and Carolina's work, what does that mingling look like as well within your agencies?
Yeah, so I mean, we love our partnership with START. We wish we had a START team in every area of Kentucky. You know, that is really honestly where we struggle, is outside of those areas. Just having, I think, that identified team and efforts where we can really target our focus. We have a great partnership with DCBS as a whole, where we did 2 trainings. We started a new Freedom House in Southeastern Kentucky in March, at the first week of the pandemic, because that's how we like to roll. And so we did some training and conversations, I should say, with some of the supervisors as well as the frontline workers last week, and then we're doing some next week with Jefferson County area, just to continue to talk about addressing those barriers. But we continue to be interested in, and we're I have another meeting with the commissioner, I believe, next week, about what we call going upstream, right? How can we continue to get how do we get families as soon as possible before the removal happens, instead of the removal happening? We know that that's just a layer of trauma that can be prevented if we can get people in care soon enough, and quick enough. And we've not, I mean, what we would love to do is to embed a worker, one of our employees, in with a DCBS, in the office, and really have that be a concerted effort. And so that's what we're working on now. But again, we're very grateful for the START team, and wish we could have that all over the state.
So for us, we do have the START team, and I'm actually, their numbers have obviously increased. Of petitions filed with the courts, and this is just because of all the stress and things COVID going on. Our biggest I guess challenge, and I say challenge because trying to keep in communication with everyone, it's really sometimes it's hard, and now we just have to make sure we do keep in communication, especially as we do everything via virtual. So we just got to make sure that that we're staying in communication, that things don't fall between the cracks, because that just, and being remotely, there's more space for that. But yeah, I mean, just lost my train of thought, but we do have a really good relationship with, with DCBS. And like I said, we just try to, have a constant communication to where else we can do, and to, if we need a case that has, high risk, we just put them in the docket just, more often, to make sure that they are doing what they're supposed to, just kind of keeping a close eye.
So we also work with START, and having clients come into a virtual space with the START team has been great. However, the longevity of being able to stay in treatment and remain in services has been a struggle for the START clients that we have had, based on the circumstances of either they get tired of being in services, or they start to relapse and they need a higher level of care, which again consistently provides more barriers to the system of change, because then what do you do with these kids? And the workers are not able to be hands-on as they were previously before COVID, and so they're not looking in on these families a lot more, like we would need them to at this point, because of the contact. And so I think it's just a perfect storm for the increase of referrals will be happening probably right after we get out of the pandemic, and see all of these families who have been affected by substances. Just right now, we just don't see that as much, as because the workers are not being able to go out into the homes.
Yeah, I think that's a great point too, in that we don't have as many eyes on those families. We don't have as many, like we talked about, I think, support systems within our families. So if folks were interested in learning how they could support families who are struggling with addiction, what would you recommend? What would you tell them? Like if somebody said, like, my cousin or my aunt or my sister is struggling with addiction. She's she's getting services, but how can I be a support? What does that look like?
I was going to tell them about Toya's group, or about y'all's group. That's where I send everyone, Toya.
Yes, they can come to the Morton Center. It's free. We have a concerned persons group, which usually filters people wherever they need to be, because we want to treat the whole family system. So if they're is aunts, uncles, moms, dads, grandparents. They can come to that group and get support for themselves, but also enroll in services and then get the kids into services, because, you know, most importantly, we want the children who are affected to be also in services, so we can start doing some preventative services, because we also know that if they're in an environment that is drug or alcohol infested, then they will tend to have those same issues as they're dealing with their own problems. And so we want to treat the whole family. And so they can just come free of charge. They don't have to tell us anything about themselves. Just show up to our virtual group, and it has been building. We have people as far as, you know, the south ends of Kentucky to the east, west. I mean, it's just really a growing program. And so I think that that is a basic foundation for families to get initial services, education. We do the education component to really help them understand addiction, so that they don't have these moral issues. You know, a lot of time people think this is a moral issue that we're dealing with, and it's not a moral issue. It's a coping skill, you know, and over time we've created this coping skill to deal with our problems and stressors. And we know COVID-19 has provided a huge amount of stressors in everyone's life. And so if you don't have adequate coping skills, then how are you going to deal with that?
So Toya, you touched on a bit about that, providing those, that support to family members is almost like a preventative measure as well. What other types of prevention or upstream services or upstream things are available for folks in order to prevent substance use or substance abuse really at all? And that could be for anyone.
I think the last time I was on this panel, you know, I think, you know, some of the things that I know, because I've been in social services a long time, is that in order to prevent, you almost have to start in vitro. Is that prevention happens in vitro. It starts with the basic services of providing WIC and those things to moms, and getting connected with moms and providing those, you know, services. And they might seem basic, but I think obviously I used to work at the Freedom House for a long time. And so, you know, I've seen those moms who were pregnant and needed preventative services prior to being pregnant with that child, and then that child born addicted. And so I think as early as we can get those preventative services in place to help moms and dads who are dealing with their own substance use issues, and then they deliver kids into this system, I think we need to be in prevention. And so I think it starts with the basic services, making sure they have housing, making sure that they have adequate prenatal care, because if we are not having eyes on these families, pretty soon, you know, that's when we start to see all of the problems. And then it goes, you know, systematic wise to schools, you know, and then the schools are not knowing how to deal with complex trauma and dealing with those issues, and they can't deal with it. And so the kids end up with a lack of education. And if you have a lack of education, then you don't have a whole lot of hope.
Yeah, I mean, Toya nailed it. You know, trauma is the real gateway drug, right? So if we can, the more we can prevent trauma, the better we're going to do at preventing substance use disorder. And we're seeing, I mean, you know, third generation, obviously, people in our programs now, and it's complex. And, you know, it's not, I say this all the time, like I was on the WLKY or the, you know, the panel, the one time or several times I have been answering the calls, and they wanted me to kind of, tell the story of, like, they said, you know, the typical, like someone had a surgery or a dental issue, and they went to the doctor and got opiates and then got on heroin. And I'm like, yeah, I mean, I'm sure that is a story. It is not the story of the people we serve, right? The folks that we support, it is complex, and that's not sexy. And I get that. Like, it's not an easy consumable story for people, but it is generational poverty, generational substance use disorder. And we've got to do the work in the systems. Like, if you think about just the trauma, the complex trauma people are experiencing where they're living in the neighborhood, even if nothing's happening in their home, right? Just by looking out their windows, by watching TV and seeing people that look like them treated the way that they're treated or killed. So just the layers, I just think that we have to tackle it from which, I mean, I'm preaching to the choir. We're on with people that are doing that, right? So we have to tackle that at every level and every layer, I think. And Toya is exactly right, preventing further trauma from providing all of those services and all of those supports.
Yeah, it's definitely a generation, cycle. Normally, our county attorney, has been a county attorney for quite a while, and will be in court, and he will be like, "Oh yeah, I know your grandmother and your mother," and so he has had several generations after generations in front of him, and so it is sad, but that is the truth. That is what is going on, and so definitely, like Toya said, we have to do it from when the baby is in, with mom, starting with mom when she's pregnant, or even it's just something that we have to break.
Tiffany, I want to touch on something that you and then Carolina really reinforces the notion that it's that trauma is a gateway drug, and we see it as generational often. If that is a story that we commonly see, what is what's something that you all talk to folks to help them understand that it's not a moral issue, it's not it's not an issue of character, it's an issue of coping, and an issue of then utilizing things that tend to numb. What does that look like for you all?
We try to get people to understand it from a very, I mean, that's why we use people's stories. We want people to understand the person and really hear their story and be able to personalize it in a way that's like, oh, that really is, that's relatable. That's something that I can imagine. If that's all I had ever seen, right, then that's what I would do. Or if that's the only way I had ever been taught. I mean, the people that the women that we see, it is a miracle that they've made it to our door. It's just like survival is, I mean, their survival skills, some of the most tenacious and resilient people I've ever met. And so I think people see that when we tell people stories. We try to do it in a very respectful way, but we do it intentionally so people can put a face to the issue. And then it's harder to judge and say it's a moral failing when I'm looking at this person and being able to identify with them and see myself or my mom or my daughter or my sister.
So from my end, we try to address not just the one, the client, but also as a family. So a lot of times whenever we do court orders, a lot of times includes a family. So whenever we have the client to do individual therapy, a lot of times we also want the family to engage, because we know that, there is more to it than just that one client. So there probably are more underlying issues to be addressed. And so a lot of times people are not very fan of therapy, but we've had several clients that, once they realize that it's not as bad as they think, they're okay with it. So guys, I will be right back, okay?
It sounds like the courts are addressing it as a systems issue, though, as well. And Toya, with you all serving young people, is that oftentimes when we see addiction start is in adolescence or when folks are teenagers? Is that most common?
Yes, and because our population, a lot of times when we get our teenage clients, they come from middle class or upper middle class parents, and a lot of times what we see is that they believe that there's no trauma. We've had a good life, you know, we've got money and we're not poor. And so what we have been really trying to restructure and help our families understand, there is trauma, even if that you don't see it initially when you make that referral or you come in. And so these kids have been impacted by school trauma. School today is not school from 20 years ago. And so school is very impactful in children. And what we see a lot of times is the parents had no idea that their children have been in a trauma situation at school. And so they dismiss the substance use disorder and say it must be something else. They must be mentally ill. And we're seeing that it's not mental illness, it is substance use.
Do you think that there is adequate information regarding the use utilization of substances? Is this a growing issue? Is it an issue that's always been there? Can you give a little bit more information on just kind of within systems for youth utilizing substances? Is that growing? Is that worse?
I think it's growing. You know, of course, we've seen the increase of vaping among children and adolescents. And so with the vaping craze, you know, we also saw that they're using marijuana at an accelerated rate. And if they can't get a hold of accelerated rate, and we know that ADHD is been overdiagnosed in children, and they're using their ADHD medications because they're not using non-addictive ADHD medications to treat children because they're not looking at the family history of substance use disorder. So of course they're giving these children something that is highly addictive. And if I don't want to deal with my issues or I don't know how, then these children are becoming more and more addicted to harder substances. And we're having to address this and talk to families about, you can't keep alcohol in your home. You can't allow your teenage children to drink with you, even if it's culturally accepted. You know, because these children are becoming more and more addicted. And so having to tell someone that doesn't think that there's any problems in their family system is tough, because they are not ready to hear that. They're not ready to hear that their children are addicted at such a young age.
Yeah. So it sounds like education would be incredibly impactful, talking about how young people become addicted, or some of the some of the things that we commonly see when that happens. But then also, I think I heard us talking about broader education about what addiction looks like and how it manifests is also important to make sure that folks have that background. Outside of education, are there policy priorities, or are there state budget investments that would help us to tackle this problem as well? I know that the blueprint for Kentucky's children is in the midst of developing their policy agendas and finalizing it. I know there's a lot of folks on this call who have been engaged in that, but what are those policy solutions look like, or what do those budget solutions look like?
I think we have been a part of a couple of groups that continue to advocate for the increased allowance of telehealth and being able to use that in places and in ways that we weren't. I honestly think we're going to be able to, that's going to be I'm hoping it's going to be a permanent thing. Like was said earlier, it's not for everybody. That's absolutely correct. And yet it helps remove some barriers for people that, and for providers. And so I think that is going to be very important. also continued relief of kind of the authorization process for some of, these systems on the pre-auth side where, just allowing people to have Medicaid, presumptive eligibility, those kind of things aren't going to be obviously permanent things, but I'm a part of a couple of groups that continue to advocate for that time period stretching out for that. Obviously, we're going to be dealing with this long after I think people are saying, oh, we're able to do things and go places without masks. The fallout from this is going to be long, and we're in for the long game as providers and as people that work with these families. Something that I've said from the very beginning of all of the federal dollars for opiate use is that is really going to tie us up. And I think that is going to be more the case now that people are using alcohol and using methamphetamine and benzos. It really ties the hands of some of the providers being able to use it. And that's obviously a federal thing, but it comes through the state, right? Through certain, so I don't know if that is both, if that's advocacy is needed at both state and federal levels or not. But those are some of the things off the top of my head that I think are going to be important at the policy level.
And I also agree with Tiffany. I think we also need to start at preventive services in the schools. I know they have mental health services provided in the school, but is it a substance use collaborative opportunity for kids to talk about these certain substances are seen in my neighborhood or my school system, and how do we get substance use disorder clinicians into the school system to help with this manifestation of how it becomes generational? Because I think that we're not doing a really great job at identifying every single family who could be affected by substances, because nobody's looking at, what's going on with truancy and how kids are affected. And so if you have a kid who is truant, is there substance involved? And, how do kids show up? And I don't know if that is a mass mandate for substance use testing in the school system, but I know if we get these kids very early on, we can have an opportunity to prevent some of these long-term effects, of course, that affects us criminally. I know that when I was in, school, one of the things that I researched was, from school to prison. And so I think that is a huge impact that we need to really effectively address. I think we address it in some ways, but I think the pipeline from school to prison is huge. And if we don't address that, then I think our dollars are being wasted,
And something we're
as
having
a community.
get very real about inside of our organization is the fact that we are not serving people. We are not reaching the populations that we need to reach. We have a very white client population, and we told ourselves for a while that it's because opiates. I mean, it's laughable that I'm saying this out loud now. I think we really believed ourselves when we said that opiates affect white people more than people of color. And we know that while that may or may not be true, we also know that the systems that are sending people to treatment versus incarceration and versus more punish, approaches, negative approaches, are impacting this, right? And so we are not reaching the folks we need to reach. We also realize that there could be ways we do services and ways we engage people that could be preventing that too. So we're really digging into that as well. We know that we have to, we're really committed to changing that.
Carolina, any thoughts on the potential for policy priorities or state budget investments to tackle some of the issues that you had highlighted?
I wish we could have more, I don't know, of everything. No, especially treatments. I know that we have here in town several treatment facilities that are religious-based facilities, which are great. But not everybody are, willing to go because the fact they are religious-based. We also need more. We have more program treatments for women than we do men in town. And also, I know we're working with Tiffany on a facility for mom and children. So that, if we can get more, even better. Or a huge, I know we can only have so many beds, but that's definitely, I know we have had several clients that have had a successful story because they were allowed to have their the youngest baby with them, and that just changed her life, and she was able to clean her life, and she now has all her kids with her, and she said that was what did it for her. She was allowed to have at least one of her children, and that, she has, I believe, like 4 or 5, and but that was just the key to her recovery, that her child was with her. But yeah, just more access to treatments that are I guess near us. When I do referrals, a lot of times I do send them kind of far away because that's what we have right now. It's kind of far away from where we are. A lot of times that's good for the client. A lot of times it's not, but that's what we have, and so obviously we have to work with what we have. We also would like to have more. Unfortunately, because we're, a government entity, we can't get a lot of money. But Judge Gordon, it is very fan of keeping people liable for their actions. So we do have a drug program ourselves. Well, we used to have one ourselves. It was funded through CASA, but obviously those funds went away pretty quick. And so right now we have a drug testing program where, it helps the clients kind of keep liable. And so they have to drug test every so often. They have to call the line. But right now we only do in self-pay, or if they have an active case with the cabinet, judge will make them the cabinet court order to pay. That's the only way they will pay. But if they don't have a third party case, which we are getting a lot of those, we can't order the cabinet to pay because they're not involved. And I'm pretty sure now that COVID has hit, their requirements whenever somebody does a referral to the cabinet, their intake requirements, I think, have changed, or they had to kind of adjust. And so we're getting a lot of third party petitions, which means that, they're not going to have a worker involved. So it's just more barriers.
Third party petitions are when a parent or another party petitions the court for
help,
for potential abuse and neglect, right? Yeah.
Mm-hmm. Okay. Yes, and we're getting those a lot. And I do think we started getting on before COVID hit. Obviously, it has increased after COVID because, DCB is still following those very strict guidelines, which I don't blame them, but it does affect the community. So, but yeah.
So I hear more investments, more services, more treatment, more education, more of a lot of it. It sounds like. I so appreciate your all's time and your comments and the expertise and knowledge that you bring to the table. This is a conversation that I hope will continue in many different arenas. I know that in the coming weeks, we will also see some Family First Prevention Services regional meetings where we will be talking about how Family First is impacting, that implementation is impacting keeping families together whenever possible. So look out for those as well. Again, Toya, Carolina, Tiffany, thank you so much for your time, for your talent, your expertise. And I'm going to pass it over to Cortney Downs to close us out.
Thanks, Shannon. I want to start by thanking Aetna Better Health of Kentucky for their support of today's Advocate Virtual Forum. And again, just a huge thank you to Toya, to Tiffany, and to Carolina for joining us and also for sharing your expertise with us. We know that COVID has resulted in an increase in alcohol usage for adults and for kids. But what we heard was that there is less interaction with the systems that would usually refer the kids and families to those services, whether it's doctors or, probation and parole or other justice related systems or even the schools. I think it's encouraging that we heard that there are still those self-referrals that are happening as a result of any issues that may have existed before being magnified by COVID, and just understanding that that could be anything from the stress of parenting and not really being able to take a break as often as you might have before to job or financial insecurity. I thought it was really important too that we heard about the impact of NTI on the geriatric populations, which is significant in Kentucky, where we have thousands of kids who are living with their grandparents or other relatives. So just thinking about that struggle with using the technology and then trying to cope through substance use, and then with the restrictions that are already in place because of COVID and this reliance on telehealth, that it almost like doubles down on how difficult it can be for that population specifically to access the services that they need. I really appreciated also just hearing about this developing understanding, I guess we could say, that people of color aren't being reached as much as they should be, that service provision may not be delivered in a culturally competent manner, and that the link between substance use and resulting punitive outcomes like suspensions in schools or entry into the juvenile or criminal justice system isn't being made or acknowledged as much as it should be. And then just one more thing, because I know I'm going on a little long here. And finally, a common theme that I think that we've heard not just today, but then like over the past few months is that we don't have as many eyes on kids and families right now. So when you are someone who is experiencing this complex generational trauma, and remember that like not everybody can identify their lived experience as traumatic and therefore won't make the connection won't be able to connect substance use to that. The need for those wraparound services from gestation to geriatrics is critical to developing healthy coping skills, meeting those basic needs, and ultimately thriving as a family. So next week, we are going to be doing something a little bit different for us, but hopefully it'll be very timely. We'll be talking about self-care for advocates. So I hope you'll be able to join us and encourage you to invite people in your network so that you work with to join us as well.